Is one dose of doxycycline good enough? Current practice in medicine is that if a patient comes into the clinic having had a deer tick bite and no other symptoms, they are given a 200 milligram single dose of doxycycline to supposedly prevent Lyme disease. Now, this practice comes from a study that was done in 2001, which claims that it prevented Lyme disease in 87% of cases with a single dose of doxycycline. Now, the problem is that there are some flaws with this study. First off, the definition of preventing Lyme was that patients did not develop a bullseye rash, and they were followed at 3 weeks and also at 6 weeks. So we know that not all patients get a bullseye rash. In fact, we know for sure that at least 30% of cases do not have a bullseye rash. Secondly, 6 weeks is likely not long enough to really, truly detect Lyme disease. And so there are many cases that are most likely left undiagnosed. Second, the sample size of the study was small. And the reason we know this is through something called the confidence interval. In a study, there are statistics that are done to show the significance of the study and whether or not we can rely on the results. One of these things is called a confidence interval. To kind of put it into layman's terms, a confidence interval basically is saying how confident are you that the results are accurate. What we're looking for is we're looking for a narrow confidence interval, meaning that, we may say 87% of patients were prevented from having Lyme disease, but what's the interval? What range could it be? If that range were narrow, say 80 to 90%, we could be pretty confident that the results are accurate. In this particular study, the confidence interval ranged from 25% up to 98%. So really, we have such a wide confidence interval that it's really hard to have true confidence in the results of this study. Think of this another way. If someone were to ask you how far it is to travel from point A to point B, you could answer by saying, roughly 10 to 11 miles. That would be a pretty good estimate, and the person you're telling could feel pretty confident that their trip is going to take about that long. Now, if you were to tell them it could be somewhere between 10 to 20 miles, well, first of all, that doesn't help anybody because there's quite a big range there, and there's a lot of room for error. The same thing happens in our studies that have wide confidence intervals. We just can't be sure that the results are going to be accurate. So what do we know? Unfortunately, we don't know enough. There's still a lot to be learned about the transmission, detection, and treatment of Lyme disease. Statistics can be helpful for the population at large, but when it comes to individuals, we have to treat them as an individual. I believe it's important for patients to understand the risks and benefits of treating, not treating, and what the different treatment options are. A single dose of doxycycline is probably better than nothing, but in my opinion, in many cases, it may not be good enough.